Meeting into order at this time, and board members and superintendent will move through each item on the agenda. I'll read them as quickly as I can, and if there's anything that you would like for me to stop, or superintendent, if you have staff here to make presentations, please let me know and we'll stop and bring them forward. Okay?
I think we've got the ones here we need.
Yes, ma'am.
I think so.
All right.
Yes, sir.
All right, so of course the first item of business will be called to order, and then the approval of the agenda. We're showing no recognitions, no visitors. We don't yet know about public comment. On item 6.1, administrative personnel appointments, the appointment of Assistant Principal 1, Choctawhatchee High School, recommended by the superintendent for approval.
And I believe you already know who that is, and we've sent you the bio, so you have a pretty good idea.
Yes, ma'am.
Dr. Hale is rejoicing. Mr. Chambers is not.
All right. Okay, so moving on to section 7, committee and staff reports, workshop only. 7.1, in-county travel paid for the period of June 21 through July the 4th, 2018, presented by Mrs. Rita Scallon, Chief Financial Officer. 7.2, out-of-county travel paid for the period of June 21 through July 4, 2018, presented by Ms. Rita Scallon, Chief Financial Officer. 7.3, quarterly report, short-term facility use contracts and lease agreements under the $5,000 threshold, presented by Mr. Vince Wyndham, Program Director, Purchasing. 7.4, quarterly report, service agreements under $5,000 threshold for internal funds and $2,500 for budgetary funds, presented by Mr. Vince Wyndham, Program Director, Purchasing. And then 7.5, updates to Okaloosa County School Health Services Manual, presented by Mrs. Terry Schroeder, Program Director, Student Services, and recommended by the Superintendent for approval. Ms. Jackson.
Yes, Mrs. Schroeder is here this morning, and this represents an awful lot of work. And I would like for Terry to have the opportunity just maybe to address this issue, and if there are any really specific highlights in there or changes that you would like to make the board aware of, because it's quite a document to read.
Yes, ma'am. So what we use this document for is to provide student health services in our clinics, the clinic techs, the nurses, those that provide those services to the students, use this as a manual or a guide as to how to handle certain situations. So that's why it's laid out the way it is. The only changes that we really made this year is on the advice of the School Health Advisory Committee, which Ms. Thrush is on with us. We added, kind of hate to talk about it, but we added an area about bed bugs, because we have had some issues with that in some of our schools. So we put that in there so that those schools would know how to handle that. The only other change we made is we updated some of the policies that you guys are going to be voting on real soon to approve. So we made those changes to reflect the policy changes that should be coming forward. So,
do you have any questions of her? Anything about that?
Board members?
I would just encourage parents, who might be watching, to read it, just because, as you said, it's a manual for our clinics and the guidelines that they use. But with 30,000 students, obviously a large population that has a variety of needs, and we do have several children who have regular health needs on a daily basis, and then when incidents occur, just so that our families understand what our procedures are, because sometimes assumptions are made, or things that we might do in our home or allow our kids to do. We have to follow, obviously, certain state health guidelines, et cetera. So it's a tremendous document, and I appreciate you always continually updating it and looking for ways to improve it.
we do, just so you know, we do use the Florida Department of Health's emergency school guidelines as our template for how we address these situations. So that's where we get our marching orders, so to speak.
And it's so nice to have a nurse on staff that is able to navigate all that for us, because frankly, I mean, we're not nurses.
Well, that's
so
right.
it's really good to have her do that, and I appreciate it,
Ms.
Terry.
Johnson.
Thank you.
Thank you.
And I just wanted to say that I'm very grateful for the work that you put into this and your committee and all the folks that were involved. And I well remember that my own copy at the schools that I worked at was well worn because of the compulsions and the requirements that schools have to do in the
Yes.
area of health. And it
Yes.
was a resource that I could look to because I'm not a health expert like you are, but it would give me guidance and would help me in trying to deal with the different kinds of situations that schools are confronted with, including the newly added item.
Yes, sir.
All right.
Thank you.
Terry, you probably wouldn't love your job so much if it used to be like years ago. None of you people's old enough to remember this, but they used to come around the schools and used to have to chase us down and gave everybody the shots.
Yeah, I
And,
remember.
the old needles was like thing, but I remember my sister, they used to have to catch her with a rope, the shots. But,
Well, I've done pediatrics, Mr. Walker, and I have chased a few kids, so I understand where you're coming from there.
Anyway,
Thank you. Appreciate
Thank you,
support.
Ms. Roeder.
Thank you.
Yes, ma'am. Thank you, Mr. Walker. All right, so moving on to consent agenda, 8.1 approval, 8.2 approval of the minutes of the workshop meeting of July 5th, 2018, minutes of the regular meeting of July 9, 2018, minutes of the budget workshop meeting of July 11, 2018, minutes of the employee appeals hearing of July 12, 2018, recommended by the superintendent for approval. 8.3 appropriation of District 3 School Board Member Capital Outlay Funds to Okaloosa Technical College and Choice High School for 9 additional Salto doors and Salto door lock systems in the amount of $13,767.12, presented by Mr. Rodney Walker and recommended by the superintendent for approval. 8.4 appropriation of District 5 School Board Member Capital Outlay Funds to Blue Water Elementary School for 5 additional Salto doors to the Salto door lock system in the amount of $16,701.55, presented by Mrs. Melissa Thrush and recommended by the superintendent for approval. 8.5 appropriation of District 5 School Board Member Capital Outlay Funds to Blue Water Elementary School for installation of AI phone intercom system for the amount of $6,659.88, presented by Mrs. Melissa Thrush and recommended by the superintendent for approval. 8.6, request to advertise a public hearing for the revision of School Board Policy 08-06 test requirements, presented by Mrs. Karen Peak, Program Director, Professional Services, and recommended by the superintendent for approval. 8.7, request to advertise a public hearing for the revision of School Board Policy 08-07, requirements for instructional personnel, presented by Ms. Karen Peak, Program Director, Professional Services, and recommended by the superintendent for approval. 8.8, request to advertise a public hearing for the revision of School Board Policy 08-08, new teacher induction program, presented by Ms. Karen Peak, Program Director, Professional Services, and recommended by the superintendent for approval. 8.9, invoices to be approved for payment, presented by Mrs. Rita Scallon, Chief Financial Officer, and recommended by the superintendent for approval. 8.10, school donations, presented by Mrs. Rita Scallon, Chief Financial Officer, and recommended by the superintendent for approval.
And I
Sure.
just had one question. I didn't get a chance to call Rita, so the way I understand the donation that's listed from Mr. Riggs for the Fort Walton Beach High School, that will become as monthly monthly donation. It won't be a full dollar amount. Is that correct? Sorry.
That's okay. Actually, what he had said initially and presented to the school and the board was to make installments of $2,000 per month, but he went ahead and paid for the 18-19 year all up front, $24,000, instead of doing it in installments.
Okay. And so this is a one-time donation, and like you said, it was done all up front.
Yes, but I believe it was more, I can't remember. Do you remember? It was like,
Yeah, I want to think this is about half of the amount
Right.
to be donated.
yeah,
Okay.
I believe so, and I didn't
And it
want
was
to
going
say.
to be out over a couple of years.
Right.
He was going to make the monthly
Right.
donations.
Right.
Okay,
But
so we'll
there
be,
should be another,
Yes.
so we'll be
donation.
setting aside a separate project for this to be a dedicated source for that turf.
Right. Initially, if memory serves me right, it was going to be that he was going to fund a portion of the turf replacement, and we went ahead and fronted that money.
Right.
And so then I will bring that money back into capital outlay
Okay.
and put it back into the
Okay.
reserves, even though we don't really have reserves in capital outlay, but
Right.
to be appropriated for other projects.
Okay.
And if I remember, I think the agreement also allowed a prepayment again in the future, should he choose to do it that way,
Yes.
as opposed to monthly.
Absolutely.
All right, thank you. All right, 8.11, payroll warrant register and accounts payable warrant register for June 2018 totaling $53,175,462.48, and bank transfers for June 2018 totaling $25 million, presented by Mrs. Rita Scallon, Chief Financial Officer, and recommended by the Superintendent for approval. 8.12, stipend for Assistant Superintendent position, Human Resources, additional comprehensive duties, presented by Mrs. Rita Scallon, Chief Financial Officer, and recommended by the Superintendent for approval. 8.13, tag on bid annual purchase agreement for indefinite quantity environmental contracting services, presented by Mr. Vince Wyndham, Program Director, Purchasing, and recommended by the Superintendent for approval. All right, here we go, service agreements. 8.14, service agreement number 19-18, Denise Dicary, presented by Mr. Vince Wyndham, Program Director Purchasing, and recommended by the Superintendent for approval. 8.15, service agreement number 19-19, Jamie Fields, presented by Mr. Vince Wyndham, Program Director Purchasing, and recommended by the Superintendent for approval. 8.16, service agreement number 19-20, Carrie Ann Klug, presented by Mr. Vince Wyndham, Program Director Purchasing, and recommended by the Superintendent for approval. 8.17, service agreement number 19-26, Sasha Hooper, presented by Mr. Vince Wyndham, Program Director Purchasing, and recommended by the Superintendent for approval. 8.18, service agreement number 19-27, Savannah Whalen, presented by Mr. Vince Wyndham, Program Director Purchasing, and recommended by the Superintendent for approval.
And
Yes, ma'am.
Dr. White,
Sure, sure.
I know those were several service agreements, but just wanted to remind the public that, you know, we're approving those, but the funding sources for all of those service agreements were internal funds. So these are resources, clinician fees for bands and dance teams, a variety of needs and services provided through these agreements, but we're not able to fund them. Those organizations and extracurricular programs are fundraising to pay for those services. So, you know, a large amount of money needing to be fundraised, and I'm grateful to our community that supports all of our extracurricular activities. But I just wanted to make the public aware that every single one of those service agreements were funded through internal funds or fundraisers.
Thank you, Ms. Thrush. All right, 8.19, 2017-2018 State Equity Report, presented by Mr. Steve Chapman, Equity Specialist, and recommended by the Superintendent for approval.
Mr. Chapman is here.
Welcome, Mr. Chapman. I think that's a call.
Mr. Chapman is moving rather slowly. He'll be having surgery next week.
Uh-oh. Okay.
So he is doing his best to persevere through all of this. This is another one of those big documents
Yes.
that requires a great deal of work. And Steve, if there is, or Mr. Chapman, if there's anything in there that you want to highlight for the board, or anything you'd like to say about the report. I have to say it's big.
Absolutely.
Comprehensive.
Superintendent, just like to add that I've looked at some of the increases, some of them minimum. However, there are increases. There's always opportunity to improve, and hopefully this year I'll have more time to dedicate working with the principals to see if those improvements can take place.
Good.
And Ms. Diska Ross was superb in her assistance, providing data, and Ms. Strickland for helping put this together as well.
Good. And do any of you have any questions of Mr. Chapman about that report?
Just took a lot of effort, I can tell that.
It really
Yes, sir.
did.
Appreciate it.
Thank you.
And good luck, Steve.
Ms. Rush?
Yeah. I was just going to say, it's really a comprehensive program. It's, curriculum, athletics, just social interaction, training. So a lot is really involved in the equity report. I know it appears it's a lot of numbers and a lot of data,
Right.
and I know Ms. Ross, as you mentioned, is a data guru, and that data is important. But as you stated, I know that we're continually looking for ways. It's a culture change that's ongoing.
Absolutely.
And just having all students and employees have a better opportunity to seek challenges that are out there and to engage in those challenges. And so I appreciate all the efforts at all the levels throughout the district, whether it's athletics or curriculum or HR department through training efforts. So.
Absolutely. I'm looking forward to working with the principals this year to look at strategies for individual schools and see if we can look at their individual data and make those changes as well.
Okay.
Thank you. Thank you, Mr.
Thank
Chapman.
you, Mr. Chapman. All right, 8.20, sale and disposal of surplus property, presented by Mr. Steve Bolton, Director of Facilities Planning and Maintenance, and recommended by the Superintendent for approval. 8.21, proposed sports and gate fees for Fort Walton Beach High School for the 2018-2019 school year, presented by Mr. Nick Kutsaratus, Assistant Superintendent of Operations, and recommended by the Superintendent for approval.
I would just have one
Yes, sir.
comment. I appreciate the fact that they're trying to get ahead of the curve to address things like the field we had to address this year. So that's the right solution to the problem.
And then
Sure,
again,
Ms. Rush.
I didn't have a chance to check with Rita or Nick, but the increase in funds, are we actually going to set aside that increase in revenue, and dedicate it to a project for repairs and replacement?
That's a better question for Mr. Spolsky. That's what he indicated, that the reason for the increased prices was to set money aside, but that was, we spoke about that months ago. So I would want to get with Mr. Spolsky
Right.
and just verify that.
But if I understand Rita correctly, like those sales come in as internal funds, and typically, the board doesn't have direct control over internal funds. But I guess that's something that I can talk with Mr. Spolsky and you about, as far as having a way to, as Mr. Destin said, prepare for future maintenance needs.
You're correct. Those gate receipts would come into the school, and of course, then they go into the internal fund. So if the intent is to use all or a portion of the increase in gate proceeds for a specific purpose, replacing the field at some future point, then that would need to be identified, and a sub-account could be set up, and that money, after each event, the portion that is supposed to go in there would go in there and continue to grow to help offset the cost of replacing that field, 10 years down the road or whatever, but that's what would need to occur.
Okay.
We will make sure that Mr. Spolsky is here on Monday night to answer any questions you have. Nick, would you get with him and make sure that he's here? That was my understanding as well.
Mine also.
Very good, thank you. All right, 8.22, agreement between the School Board of Okaloosa County and the Okaloosa County Sheriff's Office for the Choice Information Technology Institute CSI program at Crestview High School for 2018-2019 school year, presented by Mr. Dexter Day, Principal, Crestview High School, and recommended by the Superintendent for approval. Sure.
I would just add, Dr. White, again, this is just a great opportunity for our students up at Crestview, one of our career and technical education programs, and really to have a community partner with the Sheriff's Office. It's a win-win. We get students engaged in career opportunities in that field. And who knows, hopefully maybe someday somebody, one of our students comes back and serves in our community in that capacity. So I appreciate the partnership that we have in this agreement, and what a great opportunity for our students to have this curriculum provided for them.
Thank you, Ms. Rush. 8.23, school food service updated a la carte pricing for elementary and secondary schools for 2018-2019 school year, presented by Mr. Steve Anderson, Program Director for Food Services, and recommended by the Superintendent for approval.
And Mr. Anderson is here. Mr. Anderson, would you mind coming up for just a moment? Steve's been a very busy man this summer trying to get everything ready to go. Not only does he deal with state regulations, he has federal regulations, and it is quite the job to keep up with all that. Is there anything about any of this, Steve, that you would like to say to the board?
Nothing specific.
It's just, this is an AMI Kids. This is a program that is, well, I'm not looking at the right thing.
Well, I think she's trying to save you a trip.
Yeah. I was looking at the
item.
AMI Kids. And would you
Right.
tell people who AMI Kids, it is a group of students who are placed there hopefully to help them be able to
Be successful.
be successful.
Yes, ma'am.
And we provide food.
The meal
to them.
service. So the two questions, the a la carte, nothing's changed. No prices hadn't changed.
They
It's the
pay
same
us.
as last year, and the same with the AMI. We they come we prepare the meals. They come and pick them up from Elliott Point, and they do that at breakfast and they do that at lunch. And again, nothing changed in that contract. It's just a new year.
And they reimburse us for those meals.
They reimburse us. Yes, ma'am. Absolutely.
Thank you, Steve.
And,
Thank you, excuse me.
And I would just add, in looking at the a la carte items, I know I've appreciated our efforts to, maintain costs. I believe there's only 2 items, at least at the elementary level, that are over $1. I appreciate our effort to offer healthy a la carte items so that we're not competing with that lunch that students bring from home or that they might purchase in the cafeteria. So I know that's an ongoing thing to try to find healthy items at the right price that also kids will want to buy a la carte.
Right, and so all the a la carte items that we sell have to meet the Healthy Hunger Kids Free Act, so they have to be in compliance with, regulations as far as healthy snacks.
Right.
And anyone that's ever worked at a school knows that every day food's important.
Yes.
That's exactly right,
So
yes,
I
sir.
appreciate the work you've done here.
And I wanted to add one thing. Yesterday in our principal's retreat, Mr. Koutsaratis made it very clear what the guidelines are for serving food
Oh, yeah.
in a school. I don't think any principal left there, Mr. Koutsaratis, with any intention of selling anything during lunch periods,
That's right.
of doing anything that they are not supposed to do. And I appreciated you saying that to all of them, because, you know, people think it's okay to, you know, try to figure out ways to wiggle around that. But that's a pretty serious thing if we do that, and we don't want to lose the support from the federal government. So it was a good job, Nick, and I know you and Steve worked together to make sure that's done. And I think they're real clear on it, Mr. Koutsouradis.
Well, and again, I think, you know, as our service agreements alluded to, we have a lot of organizations doing a lot of hard work trying to fundraise, and you know, often food, as Dr. White just said, everybody needs food, wants food, but to ensure that we're following federal guidelines, I appreciate the effort of Mr. Koutsouradis and Mr. Anderson and our partners in food services, working diligently to you know, still allow certain fundraisers to take place, but obviously that ensuring that we're following those guidelines out there, and not competing with our food service program. So.
Absolutely.
Thank you.
Thank you.
Thank you, Mr. Henderson. Good point, Mr. Rush. All right, 8.24. This is the other item. School food service agreement between the School Board of Okaloosa County and AMI Kids Emerald Coast Incorporated, presented by Mr. Steve Anderson, Program Director for Food Services, and recommended by the Superintendent for approval. 8.25, contract lease renewal agreement and amendment to contract C08-1671-LIB between Okaloosa County and the Okaloosa County School Board for the Library Cooperative Courier Service, Florida, and the School Board of Okaloosa County, presented by Mr. Eric Mitchell, Director, MIS and Instructional Technology, and recommended by the Superintendent for approval.
And again, Dr. White, just another great, in this case, public partnership. Our local community libraries service our students throughout the summer and throughout the year, and very grateful that we can work with them to get books transferred to the right places, and use our courier services to help provide that service that eventually serves our students as well.
Thank you, Mr. Rush. 8.26, Memorandum of Understanding between the Okaloosa County School Board and Department of Health, Okaloosa County, presented by Mrs. Terry Schroeder, Program Director, Student Services, and recommended by the Superintendent for approval.
Are there any questions on that, Terry?
Well, again, just kudos to Ms. Schroeder and all of her efforts to provide various services for our students and working out all the details to make that happen.
I'm always amazed at the things that we do that the public will never know, services and things, and I know Terry's been a champion for some of the dental things that we're able to do for some of our children who never see a dentist. And she is really championed for that, and I appreciate it, Terry.
All right, 8.27, Memorandum of Understanding between Okaloosa County School Board and North Florida Medical Centers Incorporated, presented by Ms. Terry Schroeder, Program Director, Student Services, and recommended by the Superintendent for approval. 8.28, Memorandum of Understanding between Okaloosa County School Board and Children's Volunteer Health Network, presented by Ms. Terry Schroeder, Program Director, Student Services, and recommended by the Superintendent for approval. 8.29, Cooperative Agreement between the School Board of Okaloosa County and Children's Home Society of Florida to provide mental health counseling programs, presented by Ms. Terry Schroeder, Program Director, Student Services, and recommended by the Superintendent for approval. It's a big one.
Yes, that's what I was going to say. It's a big step for the school district, and again, I don't, know if we need to rehash, but, you know, because of legislation, and certainly because of the real need in our community for these students, but just to make sure that the public understands that school district employees are not providing the counseling services, and it will only be done after consent from parents.
This is huge. And the next item, Mr. Chairman, is...
Here, I'll just stay up here.
This should have been the Terry Schroeder meeting today. Terry, this next one is really a biggie. And so, Mr. Chairman, I'll let you get to that item.
Okay.
But
Well, I just agree with Mrs. Thrush's remarks that this is kind of a new frontier, if you will, for us to be involved in, and it is a consequence of legislation. It's a mandate from the state, and
Yes, it is.
we'll do it like we do everything else. I know that we'll do it in exemplary fashion. All right. Okay, so let's move on. Stand by, Ms. Schroeder. 8.30. Mental Health Assistance Allocation Plan presented by Ms. Terry Schroeder, Program Director, Student Intervention Services, and recommended by the Superintendent for approval.
And Terry did a very good job at the principal's retreat yesterday of explaining this. It's so new.
Oh, yeah.
It's so different than what we've done in the past. And being able to have state funding to provide these mental health counselors. Now, they don't provide therapy. They don't do anything like that, but they do help us identify students that are in need of some serious help. And that's been quite a job too, Terry. You have been a busy girl. You sure have.
Yes, ma'am.
Y'all have any questions about that? I think she's...
I just had one. These will be our employees?
These will be our employees, these mental health counselors that we're going to employ. And as I shared with the principals yesterday, and if you will indulge me, I would like to introduce Bonnie Barlow. She is the CEO. Come on up, Bonnie. She is the CEO of Bridgeway Center. And so your next item we'll discuss that. But I wanted to introduce you to our community partner who is also going to be that agency that we will be referring those students who are outside of our area of expertise, because our focus has to be on education.
Correct.
And what's best for these students educationally. And these mental health counselors will understand as we go through that training process with them that things that are outside our area will be referred to those professionals that deal with those types of students. Again, it will be based on parent consent, so a parent has that right to say, I choose not to, and that's their choice. But we will have counseling services with our mental health counselors, but not the therapy treatment side of things. We're calling it the non-medical approach. If there is a medication that's needed, if there is regular treatment or therapy that's needed, those students will be referred to that agency or their private physician or any other outside provider that will provide that service.
I believe, Terry, you said there would be 12?
Well, we're going to do 10 with the allocation that we're getting from the state. That's what this plan is for. We have to submit this plan to get the money. So that's what the plan is for. And then under the Title IV grant, we would like to add 2 additional. My goal is for them to have no more than 3 schools so that these folks can get to where they're needed. They'll be doing crisis response, crisis intervention, and we try to identify some of those things that would be a crisis type situation for a student. We're also going to have them collaborate with our SROs because all of these folks will be licensed, so they by law have the ability to make Baker Act decisions. So now we have law enforcement and mental health making that decision, which I think is going to be a real good support for both sides of that situation.
Well, you mentioned on the license, what type of business, so this will be statewide. Do we expect to run into a problem with certification of having enough people? Because I think we're looking at, what, 8 or 10 positions? And then statewide, is this not being implemented statewide?
Every district is doing something a little different. I would say every district is hiring more staff. We chose in our district to hire mental health counselors or clinical social workers or marriage family therapists. That was what Ms. Jackson had said to me that she wanted to do. Every district is doing something a little different. I would say that most districts are hiring mental health professionals in addition to school psychologists and other support staff. So in answer to your question, Mr. Walker, right now I have interviews all day on Monday with applicants. I have several more that will be moving over to Tuesday. I'm hoping to have at least the first 10 filled by the time school starts. We may have to wait on the other 2, but I'm fairly confident that we'll be able to at least meet most of what we're asking for right now.
And through Terry's contacts with, is it that school in Tallahassee?
The Seminoles, yes, ma'am.
Yes, it's that school in Tallahassee. She's able to reach out to them and bring those people that are receiving these degrees and these certifications. So that's been a plus for us as well. And this is something that's very new. I've spoken with the sheriff, I don't know how many times, and others about, you know, we're trying to do this the way we know how to do it, but you got ahead of the game on this one, and we started early.
Yes, ma'am.
So that's going to be, I think, good for us. We don't want to be in the therapy business. That's not our job. We want to be in the business of, we think this kid has a serious problem,
Correct.
and we need to get this child some help.
And the other thing I see these folks doing is providing that time that some of these children need with that trusted adult. I mean, some of these children come to us with very little social emotional skills. We are already looking at different curriculums to have them for our intervention side, for MTSS, multi-tiered system of support. And so through small groups, through putting some of these children that are struggling with the same social emotional type issues, just giving them that extra support, those extra skills that they would need to be successful in school. We all know that, you know, mental health is a big deal. If a kid has lacking in those particular skills, they're going to have a hard time learning to read and write and do math problems if they can't sit next to their friend and learn how to get along. And so that's one of the goals. And my vision is if we can catch them early, then we may be able to avoid some of the problems that we see in some of our older students. And I do want to give kudos because I have been working very closely with Bridgeway over the last few months and leaning very heavily on their expertise. And they've been very willing and helpful, offering to do some trainings for those folks that we're bringing in, offering to add that extra support, that collaborative piece. And so that's why I wanted you to put a face with the name of the agency that I'm leaning very heavily on to help us get this model up and running.
I have one other question. Sure.
Yes, sir.
To drill down on the certification and the licensing, since these folks are going to be our employees and we'll be responsible for what they do or what they don't do, tell me a little more about what the requirements are.
Okay, so I'm going to defer to Bonnie on that because I'm not a mental health counselor.
All the licensed therapists are licensed through the Department of Health, state of Florida. They are responsible for their license. They have to have continuing education. They have to renew their license every 2 years. So they are responsible, just like a physician would be, or a dentist, or anybody that is licensed. So they are responsible for that. We recommend that if with our therapists that of course we have professional liability coverage for them and that covers, but some of our therapists also have an independent policy as well for that professional liability. But licensed therapists are generally very cautious. They have to protect their license, that's their livelihood, and they have to get the continuing education. That's their responsibility because it is their license. So you will find that it'll be very little burden to the school board.
So how do you acquire the license? You have to have certain degrees,
Yes,
certifications?
you have to go through, get your master's degree, and then you have to go through a clinical internship that is, depending on your licensure, it can be up to 2 years, 2,000 hours, where you are being monitored by a clinical supervisor, and they observe you doing individual therapy, group therapy, assessments making sure that you are using the right evaluation tools and that you're making the right diagnosis. So that is a year. You also have to test before you can get your licensure. So it is a very arduous process, and it shows commitment once you get that license. So you have that clinical supervision, you have testing that you have to go through, and then your license has to be renewed every 2 years. And that is all on the employee to get that done.
Thank you for those details. They make me feel better.
Yes, sir. Yes, sir. You're welcome.
And I had a couple of questions
Yes, sir.
about that.
Sure.
And because I don't know. Could a mental health counselor also be a therapist?
Yes, these are trained therapists. They come into the field to do therapy.
Okay.
Now, what we find is that, just like everybody else, they have different areas of expertise.
Right.
I'm sure Terry's going to be interviewing people that want to work with children or adolescents that want that, but they are trained therapists. They could open up a private practice with that license, and so they are definitely trained therapists.
But I think I heard you say, Ms. Schroeder, we won't be doing therapeutic services.
That is correct. We will be
Okay.
doing counseling services, but in my conversations with Mrs. Jackson and Mr. Officer Venuti was also in those conversations, we just thought for our purposes we wanted the highest level we could get
Right.
based on the decisions that these folks would have to make without a whole lot of support outside, so to speak. So we wanted that highest level.
Right. And then the second follow-up question is, I heard you use the term diagnosis.
Yes.
Will that be something that we will be doing?
I would say no, because that's not the role of these therapists. They are to do crisis intervention, crisis management, make sure that there's some stability. They'll refer those children and adolescents to Bridgeway,
There you
where
go.
our therapists, because when you make that diagnosis, then you start a treatment plan.
Right.
And so that would be not appropriate for the school therapist to make a
Now,
diagnosis.
is that to say that they won't recognize
Yeah.
Sure.
something when they see it?
That's their
Absolutely.
job.
And again, we're going to go back to that collaborative piece. Now, again, we will have parent consent. Everything's going to go through. We won't be releasing information. You know, we're going to follow the law as far as HIPAA and parental consent and all of that release of information. We're going to be following those laws that are in place. But when you talk about a diagnosis, I suspect that they'll be able to recognize
Yes.
something and then be able to collaborate with that therapist that's being referred and say, you know, this is what I see, this is what, you know, this is what I
Yes.
would
I
recommend.
understand. That's their training,
Absolutely.
their
Yes,
expertise.
yes.
And just a couple of other quick questions. So the intervention model, for lack of a better term, is what I'll call it. How will that work? Will it come as a referral from the teacher to the guidance counselor? Just in general, how would these services be accessed?
Thank you for asking. I'm glad to get a chance to share that. I shared this with the principals yesterday. When I went to the state meeting back in June, DOE was there and said, our expectation and our vision for this is that this will come through the multi-tiered systems of support, the MTSS system that we already have in
Right.
place. We already have the early warning systems in place, which was last year, legislature dropped that down to kindergarten to 8th grade. So we're going to be using the early warning systems, those 4 indicators. Let me see if I can remember off the top of my head right now. A level 1 or level 1 on state assessment, 90% below 90% attendance, 1 or more out of school or STP referrals, and failing. I think it's 1
Okay.
core class, math or English, that kind of
All right,
thing.
so there's some criteria.
There's some criteria. So that's the early warning system. The other side of that is going to be the MTSS system. And so our schools are already working on, they're already doing the MTSS for academics. They're already doing it for behavior. So where we see this fitting in is for those students that are already struggling behaviorally,
Sure.
so to speak.
Sure.
They've already been recognized.
Right.
The dean recognizes them, usually the assistant principal, the principal recognizes them. They've had several referrals, the teachers had conversations. That student should have already been identified and be in that MTSS process. they should already be looking for interventions. These mental health counselors will be a resource for interventions, so to speak. So again, we will get parent consent. The parent can choose not to let their child see the mental health counselor, but then a tier 2 intervention would be group to work on conflict resolution.
Sure.
Or a tier 3 could be a one-on-one, maybe once a week or twice a week meeting with that mental health counselor, check in, check out kind of thing. And so I'm not a mental health counselor, so I can't tell you what exactly the interventions look like, but the referrals will come through on the intervention side through that MTSS process.
Okay. But there is a way to access the services on an emergency type
Absolutely.
basis.
And we're calling that crisis response.
Okay, very
One of the things I made very clear to the principals yesterday is we cannot be using these folks as discipline. There's a whole different side. And so, you know, just because a student is having a struggle in a classroom at that particular moment, that's not necessarily going to be a crisis. Now, I don't know if I have shared with you before, but we are starting a new program with the Sheriff's Department this year called Handle with Care. And the vision of that is if a student has an encounter the evening before with law enforcement, so to speak, maybe domestic violence, maybe drug arrest of a parent or a family member, sibling, something like that, the officer responding will get that child's name, an approximate age, whatever information they can gather. They'll send me just a quick little snippet of the student's name and the age.
Okay.
And then I will find out what school that child is at and just send the parent, and not the parent, the principal a notification. There will be no specific details. There will be no specific, you know, this parent was arrested, that. It'll just be a notice that says handle with care. I call it extra grace required. That particular student might need a little extra support that day because of an incident that happened at their home the night before. That would be a crisis response for our mental health counselor.
Okay.
They would maybe have a conversation with that counselor. Hey, how you doing? What's going on? If maybe a disclosure happens for some type of situation at home, that might be a crisis response kind of thing. A loss of a family member, that would be a crisis response. And as I shared with them yesterday, it was including but not limited to, because we don't know really what we're going to see. But what we can't have is everybody in the hallway pulling the counselor saying, hey, I need you to see this kid, I need you to see that kid. There's got to be a system in place so that we're utilizing these folks to the best of our abilities.
Just one last question.
Yes, sir.
When can we advertise?
It's already been advertised.
How are we doing?
I've got a full day of interviews on Monday.
Good.
And several more that are waiting to get their applications completed through HR.
Okay.
So I'm hoping to have most of them in place by the first of the year.
Awesome. Awesome. Any questions, board members? Ms. Rush?
I had some questions just based on the discussions. On the licensure, you know, I know the Florida Department of Health has basically like a practitioner profile, if you will, so that you can check the licenses that you were discussing. Since they'll be our employees, do we have a system through HR? You know, as you stated, it's really on that individual to maintain their license. But how will we ensure that our employees have their license, it's clear and active, there's, you know, that DOH website is very comprehensive, and you can go look and see if it's a clear and active license, if there's a problem with that license, or if it's inactive. So do we have something in our system that is going to ensure that those licenses, just like the teachers, maintain their certifications?
So I've been in communication with Mandy Jeter,
Okay.
and she is the one, she's my analyst for my department, and so
Okay.
she's been the one that's been clearing these folks for the requirements that are on the job description. I will follow up with her again today. I haven't asked her those specific questions as far as is she, you know, they submit to her, it's my understanding, their license, a copy of their license. As far as DOH, I'm going to have to make sure that we know the process of there's no action against
We
that.
know the process.
Okay, she's got it.
Yeah. In the professional services office, of course, is certification. And just like our psychologists and
Right.
our physical therapists, a number of our employees that work outside the classroom have licenses.
Right.
And that falls to our department to make sure those are in order.
Okay.
And that are kept up to date.
That's why I just wanted to
I
make,
love
to
trusting
make
HR
sure.
with this stuff.
Okay.
We just got to get them hired.
Along those
Thank you.
lines, I guess I can't help but follow up and wonder
Sure.
about our evaluation documents. I mean, are you
Got it
gonna-
covered. That also help,
Gonna have
falls
to
in.
redo them, I guess.
Right,
for
well,
this
they'll have
group.
the therapeutic, we have 8 different observation instruments. So again, depending on what job services a person performs, they have a specialized observation. So they will have a therapeutic
Okay.
instrument.
All right,
Thank you.
Ms. Feast.
Okay. And then on the liability piece, does this modify, or, as Ms. Peak stated, we already have school psychologists and et cetera. So there's not a need to update, modify, change our liability, any liability issues for the district in regards to
That's
mental
a
health
question I'm not sure
counseling
the answer.
services.
You'll probably just need to add the names to the list of
Okay.
employees, and it
Okay.
should be covered.
And
And
then,
several of them will come with their own personal liability insurance as well.
Well, and along those lines, I guess Mr. McKenna said would move in your direction to make sure that our risk management protection is inclusive of these individuals.
Yes, sir.
Okay.
and you mentioned record keeping, and again, we already follow HIPAA guidelines, but if this is part of our MTSS process, there will be documentation in this student's records. So again, this information will go with that student's academic and
We're gonna
records.
So the non-medical perspective of this type of service is where there's not going to be very detailed record, because keep in mind, we're doing counseling, we're not doing treatment and therapy. So there will be notes kept, and they'll be kept separate. I've already created we're calling it the pink folder, because the pink folder is going to be the mental health records. Those are not going to go with the student outside of our district. Those will stay in our district as far as the specific records.
And I mean, that's kind of what I'm alluding to. We have a lot of military dependent children. Sometimes that's traumatic in itself with the various moves they make or deployments, et cetera. And these types of records, maintaining them, transferring them.
Yeah, we're going to follow the same model that the MFLACs do, and those records, it's my understanding, don't transfer with the student.
And that's the military family life
Yes,
counseling.
ma'am.
Okay.
So that piece will stay the property of the school district. Now, if a student is, and this goes again over to the safe schools side of the house when it comes to imminent threats and those students that are dangerous and all, we are required by law to release certain information to other entities and school districts. But as far as just the mental health piece, interventions, we won't be releasing anything related to the mental health, because again, we're going to go back to treatment and therapy is going to be done outside of our purview. Counseling is going to be, again, it's going to be just those conversations that those students have. So there's not going to be a significant record kept. There'll be dates, times, maybe basics of what was discussed, but there won't be in-depth. And what is kept will stay in that pink folder and will not go with the student when they transfer out of our district.
And when you say pink folder, that's
Sort of like the
not
red
going to be
folder.
part of our digital student record.
There will be a digital record kept for Medicaid billing.
Okay.
But it's just going to be the minimum that's required for Medicaid. And I'm going to have to defer to Tom Gray and Rita's department on what is required. That's going to be really the only digital record. There'll be a record kept sort of like the same type of record that we keep with our school psychologist.
Okay.
There's been a referral because we're required by the state now to to report to them every year how many referrals, how many visits took place, how many outside referrals happened. We're required in this new legislation to report to the state annually in September those numbers. So we have to keep some type of record for that data.
Okay.
But as far as, I understand what your concern is as far as releasing mental health information.
Well, and that concern goes both ways.
Right.
The receiving school, if they don't get information that may be critical.
Right. But as you stated, we follow state law, federal law. And then the final question that I have was in regards to the STP program that we have currently, that works with behavior modification. I know you mentioned this program working with our existing MTSS model, SROs. What about our STP program?
So those students that are having frequent visits to STP should already be considered for the MTSS process.
Okay.
So those two, that's an early warning indicator number one, and those kids should already be being looked at for MTSS if they are being sent to STP several
Repeatedly.
times. Yeah.
Okay.
And the early warning indicator is one or more. So because there is a discipline, and I'm not the discipline expert, but there is a chain of discipline. And by the time you get to one or more STPs, you've already been seen a couple times. You've had a conversation with the teacher. There's been several, things that have happened prior to that. It's my understanding. So.
Thank you.
And the only thing that I would, and I'm sure you've done this, and Mr. McInnes, I know you've probably been involved on this issue concerning records, and I just hope that you guys, and I know you will, continue to communicate about that.
Yes, sir.
So
Yes, sir.
that we know that we're getting the legal advice
sir.
that we need.
I'll make sure Mr. McGinnis and I get together again before school starts, and we have a process
Very good.
ironed out for that.
Very good, very good. Anything else on this item? All right, well, thank
Sorry
you.
to take
Good
up your
job.
whole meeting.
Good job, good job. Well thought out. Okay, so moving on now to item 8.31, Memorandum of Understanding and Business Associate Agreement between the School Board of Okaloosa County and Bridgeway Center Incorporated to provide behavioral health services, presented by Ms. Terry Schroeder, Program Director, Student Intervention Services, and recommended by the Superintendent for approval. I think we talked all around this one already. All right, 8.32, Interinstitutional Early College Dual Enrollment Articulation Agreement between the Okaloosa County School District and Northwest Florida State College for 2018-2019, presented by Ms. Cindy Gates, Director, Principal Evaluations and Special Projects, and recommended by the Superintendent for approval.
And I would just add, we're very fortunate to have the caliber of a community college that we do have in Northwest Florida State College. And again, one of the myriad of opportunities that's available to our high school students. And it meets, a variety of different needs for some students who want to go ahead and pursue this opportunity. So.
8.33, Kindergarten Report Card for 2018-2019, presented by Mr. Jeff Palmer, Director of Elementary Education, and recommended by the Superintendent for approval.
I just wanted to thank Mr. Palmer and the kindergarten teachers that work so diligently really every year on updating this document. Kindergarten is, a lot different now, lots of expectations, and thankfully we're all very different. So I appreciate the effort of all of our kindergarten teachers throughout the county who have a variety of students come to them at the beginning of the year, and ensuring, as we state so often when we start talking about assessments, that we're really seeing growth on an individual student basis. That's the most important thing, and these documents such as this teacher guide allow that to happen, because we have some students come into kindergarten who are already reading, and we have others who just aren't there yet, and so we all get there at one time or another, and I appreciate the tremendous job our kindergarten teachers do in this county, and thank you for this teacher's guide.
Thank you, Ms. Thrush. All right, 8.34, Okaloosa School District 2018-2019 Pupil Progression Plan, presented by Mr. Marcus Chambers, Assistant Superintendent, Curriculum and Instruction, and recommended by the Superintendent for approval.
And I would just add again another big document. I appreciated the change document that went along with it. Obviously, it's something that needs to be updated annually with legislative changes that are presented to us very quickly. We have to turn around and make them happen for the upcoming school year. So again, I appreciate all the efforts to get these peer groups to align with whatever legislatively was mandated for them. And I just encourage parents to look at the pupil progression plan. It's posted on our website. And I know if approved on Monday, we'll post the new document already for the upcoming school year, but very comprehensive, especially in talking about matriculation for our elementary students and our high school students, and all the options, if you will, that are out there for students to be successful in our school district.
Yes, ma'am, and I appreciate the fact that we put it online, because whenever there are questions about what does my child have to do to be promoted, it's easy to refer them to this document. And because quite frankly, those answers are sometimes different depending upon what grade level and what's required. So having this available, readily available for folks to look at and consult, I really appreciate that. So thank you for doing that. All right, so that finishes up consent, and moving on to Superintendent's Human Resources recommendations, item 9.1. Deferred Retirement Option Program drop, presented by Mr. Marcus Chambers, Assistant Superintendent for Curriculum and Instruction, and this item's for information only. 9.2, Out of Field Report for the 2018-2019 school year, presented by Ms. Karen Peak, Program Director of Professional Services, and recommended by the Superintendent for approval. And when I saw it, I thought it grew. But there's a reason for that, and that's because we're getting ready to start school, and I understand. Thank you, Ms. Peak. 9.3, Personnel Recommendations, presented by Mr. Marcus Chambers, Assistant Superintendent, Curriculum and Instruction, and recommended by the Superintendent for approval. 9.4, Substitute Recommendations for the 2018-2019 school year, presented by Mr. Marcus Chambers, Assistant Superintendent, Curriculum and Instruction, and recommended by the Superintendent for approval. 9.5, Employment Separations, presented by Mr. Marcus Chambers, Assistant Superintendent, Curriculum and Instruction, and recommended by the Superintendent for approval. 9.6, Employee Transfers, presented by Marcus Chambers, Assistant Superintendent, Curriculum and Instruction, and recommended by the Superintendent for approval. 9.7, Employee Suspension, presented by Mr. Marcus Chambers, Assistant Superintendent, Curriculum and Instruction, and recommended by the Superintendent for approval. 9.8, Leave Without Pay, presented by Mr. Marcus Chambers, Assistant Superintendent, Curriculum and Instruction, and recommended by the Superintendent for approval. Item 10, we don't yet know if there will be any. 11, Construction Program Owners Representatives Business, Program Status Report by the Board's representative to the construction program. Mr. Walker, would you prefer to give it now or wait till Monday?
I want to mention to the board that we'll be, and I'm not for sure where we brought it to the board in the past, but just to make sure that we are abiding by what we need to do, I'll be suggesting that you boards vote on, we're fixing to have a meeting to vote on the Jacobs contract, or the contract for that, and so Mr. McGinnis, I think I discussed that with you previously, but just to be certain, then I would like to, whatever we need to do to make sure, we need to get that in motion, because that contract will be expiring about the 15th of next month. So I think what we need to do to make sure the board's aware that we're going to be doing this committee and bringing back the results to what we need to do.
Checking on that now to be sure we know the process that was used the last round when this was put out for proposal, and we'll simply be following that same procedure.
It's something we've done many times, but we'll be making sure you board are involved and know what's going on.
And that's the RFP? This goes out for...
Ms. Jackson, Rita, we won't be coming, we won't be doing anything till Rita has RFQ and all that.
Oh, that, so this will go out, okay.
And it'll be just a normal process we've always done, but won't let you board know that we'll be trying to do that fairly quickly so we can get it in and, you know, find out in case we end up having to have a large project or something, we'll actually be able to
Have someone contract.
Right, okay. And Mr. McGinnis and Rita will make sure that we get everything in place before we do that. Okay?
And my assumption is that, and I see Mr. Bolton and Mr. Wyndham sitting, that's underway now. We're looking at getting that process established. Is that correct?
Well, it's really Nick,
Okay.
and,
However,
which is Mr. Bolton's supervisor, but Nick and I have been in constant communication with him, and we're getting it all in place, and as we've done in the past.
Yes, sir.
And make sure you board will be knowing what's going on.
Yes, sir. There'll be an agenda item
And,
once
To give you an
all
idea,
the-
the
everything
committee
is
has
in
always
order
been natural. It'll be, for instance, Nick, Steve, Bill Smith has always been on it, Rita and myself as the chairman representing
Sure.
the board.
sure.
the agenda item will be brought forth when everything is ready. And
Oh,
you'll approve the committee and the RFQ to go out.
RFQ. Okay, that's what we're going to call it. All right, Ms.
And
Thrush.
that's what I was going to ask. So the board will actually be reviewing the RFQ itself before it's released for people to respond to. So if modifications need to be made to the RFQ, I'm assuming the committee is going to come up with the request for qualifications and what's in that RFQ, what the requirements will be, or will the board have input onto that?
Typically, we put, like all other bid documents, Mr. Wyndham would send that out at the, after approval from the board. We usually review the RFQ requirements, the specifications and all before that goes out, make sure all the legal part is good. But I don't think in the past that the actual RFQ's been presented to each board member like you're suggesting there. The packet is put out. We receive the respondents and they assess them in their presentations at that point. And just like all other RFQs, then it comes to the board.
That's the role of the committee. It would be a review committee as with all of your solicitations like that. Typically, the RFQ is developed in purchasing and with the district departments that are responsible for that contract. That the selection committee would not be involved in reviewing the RFQ draft or anything like that. They would be called in when the responses have come in, and they would do the evaluation and scoring, making recommendations back to the school board, which is consistent with the way that process works.
Right.
Well, it's been, hey, we've done it. This will be the 6th time it's been done, and virtually it's been changed very little, but Ms. Kay and her department takes and reviews it, sends it out, and then, as I said, but it's something that has been done, and if there are any changes that need to be made, they could be made, but then when it's all done, nothing's official till it's brought to the board, and then if the board then wishes to approve it, they do. But it's like any other thing that we've done and we do. It's nothing different in this particular thing. I think this is the 5th time, and we have changed it, but very little. But I mean, in some cases, we've had a lot of cases where we had several, 5, 6, 7 people bid. But then here lately, naturally, because there's very little people interested, because we all understand we don't have any money. But I mean, but eventually when we have the meeting, then we score it and do all that, and then bring it to you board members to have the final say.
And so I appreciate you letting us know about the
Right.
thing coming
Yeah,
up.
and the main thing we need to do is need to get it moving,
Right.
because we got caught one time to where we didn't have a contract, and then we wanted to do business, but we had to wait almost a month to do that on an emergency type situation because we didn't have the contract. And that's the reason I'm
Right.
letting you board members know that we need to get this moving and get it done, because the contract's fixing to expire. Right.
And what I'm hearing, the good news is
That's-
we're underway.
That's correct.
Okay.
That's correct.
Ms. Thrush, just want to clarify your question. The way I understood your question was you'd like to review the RFQ before we put it out on the street, so to speak, that you and the board would like to review that. Is that correct?
Well, as Mr. Walker just alluded to, we have made changes over time to that RFQ. And because we are in this situation where we are, as Mr. Walker stated, while we don't currently have a lot of money, we have a lot of needs. And we are going to need to plan for the future, whether we're going to receive an additional source of revenue or not. And so I think it would be prudent for the board to review that RFQ, once district staff, as per the guidelines we normally follow, creates it, to see if we might want to make modifications for future plans. I mean, we've stated numerous times that we fell over a cliff a long time ago. We are in dire straits with our facilities as far as the maintenance needs, the renovation needs, and then our capacity needs with our enrollment issues and the limited space issues that we have throughout the district. And so I would, and that's something that I can request individually, but I would prefer that all board members receive a copy of the RFQ for review to make sure that if, for example, if the board was to at a future date approve a referendum again for a sales tax or some other additional revenue source, that the respondents to such an RFQ would be able to meet the needs of possibly a future revenue source.
Well, and as everyone recognizes, I'm the owner representative for the school board, and absolutely I have, if y'all want to see the RFQ, once Ms. Scallion has looked at it, sent it out and done, no problem. The main thing I want all of us to, the main thing is we need to move out to get it done. And if any of you board members, wish to review or recommend some changes, fine and good. And Ms. Scallion, once she comes, we're not going to do anything until her department comes back and gives us okay of what the RFQ is. And then at that point in time, if you board members would like to look at it, review it, or make some changes, feel free. But the main thing, we need to move out on it and get it done. And that's the point I want us to all understand.
Mr. McKinnon?
I just wanted to comment, if we can have a chance to work with the purchasing department, it would not be customary to bring to the public board meeting a solicitation document, because those are sent out under seal with certain deadlines. They're public once they're issued, and then vendors and responders are responding with their sealed packages typically. Now, I understand an RFQ is not a hard bid, but it's still considered to be a competitive solicitation. And we would not routinely bring that to the board and have it disclosed and
public document,
and everybody looking at it before it's been put out for the vendors to start responding to. Now, I don't know that there's any reason that a board member could not read the draft before it was issued publicly. But I just didn't want to leave a perception this morning that that's just going to be put out on an agenda and be brought forward. I don't think that would be customary. The reason it's so important on RFQ, and we ran into problems with this in the past, is so many of your bidders do not follow and abide by them, and then we've ended up with big controversies when we ended up having to throw them out, and then like if we reviewed their credentials and they didn't follow it. That's the reason it's so important to make sure, as Mr. McGinnis pointed out.
Just one quick question. Mr. McGinnis, I guess I'm getting a little confused. Can an RFQ go out without review and approval by the board? That's a request for quotes. In other words, it's
It's a request for qualifications.
okay, that's
Not quotes.
Yes, yeah,
Gotcha.
right.
All right.
Right. It's not
And-
nothing to do with.
Yes, sir,
it.
Gotcha.
that would not be unusual, particularly if you've got a contract coming up that is,
Okay.
you know, if it's
And
one that has
nothing's
to be.
final until the
competed.
board approves it.
right. Okay, thanks.
Ms. Callen.
And from all of the discussion, I think what I hear is, once staff, typically you take the last RFQ for whatever particular service, unless there's a significant change, then you start with that document and staff looks at it as to what worked, what didn't work, what needs to be changed. So once that document comes to finance purchasing, then what we'll do is we'll send an email to each individual board member to just look at that draft, and if there's any input, concerns, or whatever, and if you can let us know that, then if that can be incorporated, we can do that and then send out the RFQ.
And Ms. Callen, I very much appreciate Mrs. Thrush's comment, because this agreement is for how long of a period of time normally?
Typically, it's 5 years.
5 years.
And it can have some annual renewals if you choose to put that in the contract.
And so I'm sure that based upon Mrs. Thrush's comment, that your RFQ will provide some kind of provision that the applicant, if you will, would be able to address the needs that might become apparent should there be a sudden influx of revenue within that 5-year period.
Absolutely, because when you're asking for requests for qualifications, you're looking at the experience, the size of the firm, you're looking at the capital structure of the firm. Are they viable? Can they handle if we were to do a sales tax,
Right.
as we've done in the past? So you're not going to look at it just from the amount of money we have today. We're going to look at it comprehensively.
Very good. Very good. Is that accurately? Okay. Thank you, Ms. Scott. Okay, anything else, Mr. Walker? All right, yes, sir. All right, item 12, information technology. There are several here. Let's go through them. 12.1 CACI Task Order Number 2-103, Revision 15 Salto Doors at Blue Water Elementary School, presented by Mr. Dustin Keith, Specialist, Seat Management, and recommended by the Superintendent. 12.2 CACI Task Order Number 2-106, Revision 1 Phone Intercom at Blue Water Elementary, presented by Mr. Dustin Keith, Specialist, Seat Management, and approved by the Superintendent for approval. 12.3 CACI Task Order Number 2-108 for mini retrofit at Okaloosa Technical College Choice High School, presented by Mr. Dustin Keith, Specialist, Seat Management, and recommended by the Superintendent for approval. 12.4 CACI Task Order Number 2-109 for the addition of 9 doors to the Salto system of Okaloosa Technical College Choice High School, presented by Mr. Dustin Keith, Specialist, Seat Management, and recommended by the Superintendent for approval. 12.5 CACI Task Order Number 2-111 for CCTV repair at Antioch Elementary, presented by Mr. Dustin Keith, Specialist, Seat Management, and recommended by the Superintendent for approval. Board members, before we start the next sections, I would point you to item 16.1, a public hearing, revised job description for delivery personnel, school food service, presented by Ms. Lindsay Maxey, Specialist, Human Resources, and recommended by the Superintendent for approval.
Dr. White, I'm
Yes, ma'am.
glad you have good peripheral vision.
Pardon me?
I'm glad you have good peripheral vision, always looking over to me. But I was back on item section 12.
Okay.
I just wanted to comment again for the general public. The 12.3, the mini retrofit. So it's really not the entire what we would like to do, it's what we can afford to do. But I just want the public to understand that we have very ancient, antiquated phone systems in many of our schools. And I think a lot of people assume that we have voice over IP, for example, phone systems at our schools, and we don't at a majority of our schools. Network equipment, and this is a mini retrofit, but it's costing $250,000, $250,000. So when we look at our capital budgets and the needs that are out at all of our facilities, approximately 40, we can't do that. So we're having to prioritize and take the small amount that we have available and make upgrades when we can. And in long term, there's a return on investment, but certainly not enough immediate return on investment to cover the upfront cost of these
Right.
retrofits.
Over at the OTC campus, what we're doing with this project is we're bringing the entire campus up to code as far as every other campus in our school district. We're bringing OTC's campus, their network infrastructure, up to code. That network was ran by students 15 to 20 years ago as part of a class that was at that school. We've supported them and kept them up and going, but at this time, this would set them up to be at the same standard
To be a
and level
same standard, right.
as other schools. Yes,
So
ma'am.
I appreciate it because, again, a lot of the programs and services we provide at that center serve adult students primarily, as well as some high school students.
Yes, ma'am.
But the technical needs, the infrastructure needs are high because of the automotive programs, the welding programs. While there's a lot of physical parts of those curriculum, there's a lot of technology parts of those curriculum. Our automotive program, our welding, all of those career technical programs use a lot of software, very data driven. So I really appreciate that mini retrofit.
Yes, ma'am.
But just wanted the public to understand the sheer cost associated with some of these very needed upgrades.
If there's good news to say, and I will say this, the retrofit would have been probably 4 times that cost if we had done it 10 years ago. So costs have came down because technology has changed, and we're going to be wanting a lot of wireless infrastructure in this retrofit. So that's helped us in this regard.
Not
But
pulling
yes,
cable like you used to.
yes, sir. Thank you.
All right. Thank you. Thank you, Ms. Thrush. All right, so Section 13 and Section 14, attorney's business and superintendent, you can talk about it today, or you can talk about it today and Monday, or
No
talk about
report
Monday.
today.
All right,
Just
Mr.
had
McInnes. Ms. Jackson?
A couple of things.
Sure.
We had a great principals meeting yesterday. It was long, and it was a lot of information because each year a lot changes. And I just commend these principals for being able to sit here that many hours and listen to people talking at them all day. But it was a great meeting, good information. I did want to let you know that Mr. Danny Dean, who was unable to meet you guys when we appointed him, I'm going to ask him to be here Monday night
Okay,
just
good.
to introduce
Yes,
him
ma'am.
to you
Good,
so
good,
you'll
good.
know his face. Yesterday, during the principals meeting, I had a principal come up to me, and Mr. Kutsaratus, I'm glad you're sitting down, you and Nick, and she said that a particular church in the community was closing down their elementary piece and wanted to know if we would be able to accept 60 additional students in the south end of the county. Well, we're pretty full in the south end of the county, so I wanted to talk with you again later today so we could get some exact figures. But that's one of the things we're possibly going to face. So there might be some need for additional portables. I just don't know yet. It will depend on where these kids are zoned. We have to get an idea of where that is. But I just wanted to let you know that that might possibly be coming down the loop. And the insurance piece for the therapist and the people like that, that's something I'm very interested in, and I want to know a little more about that. And I'm going to be meeting with Russ and talking with him about that.
Very good.
Okay?
Very good. All right, thank you, Ms. Jackson. All right, so moving on to board members. Mr. Walker, do you have anything?
Not a thing.
All right, Mr. Destin?
Had one request for information. Ms. Jackson met with all of us about the revamping of HR.
Okay.
And part of that was to move out of present location up here. And I would request if there are any construction drawings or cost estimate on what it'll cost to do that. If you can make those available to us, I would appreciate it.
I believe at this time there will be no construction cost. The only thing that we're buying that I know of are the freestanding partitions that we'll be using in the computer lab. And do we have a price on that, or we were trying to get a price on that?
And the price is still flexible, but like Mr. Jackson said, it's a partition type system like you see in many businesses nowadays, where it's an open room and then you have it kind of sectioned off. But right now, which we're getting a firmer cost, it's about $13,000.
And are there any drawings depicting what we're going to change and what we're going to put in place?
We'll get that with you. We'll get that to you, sorry.
Thank you, sir.
We did have one drawing, I'm sorry, of where the partitions would go in there, but as far as any other construction, I don't recall any
It's not,
at
it's
this
not
point.
construction, it's that system
Whatever
where
you
things
have.
lock together.
Okay.
Now, and I don't know how you're going to do it, and I've done things like this before. And it may be that you're just going to transfer costs, but I'm assuming that these folks will need telephone, computer access, and those kinds of things. And my experience has been is that was a cost item to make those moves and those changes.
Sure. I can address that really quickly. Because of the phone system that they're using in HR, they're using our SIP trunk phone system.
Okay.
It would just plug into the existing drops that are
Okay.
in the computer lab. So there should be no cost with that move.
Okay.
Because it just be unplug and plug in
Okay. And
by
so
the
we'll
user.
just transfer the cost associated with running that system where we currently are to here. So that would be
Well,
cost neutral. Well, go ahead.
And the thing that we need to be aware of is, not very long ago, before Marcus had taken over HR, well, there's a proposal, we was gonna move the insurance building from down at the old complex to over there at the Votech, so that they could be close to HR, because that was under the, and you know, at some point in time, we don't have to address something on a permanent basis, folks, because, you know, we built the nice HR facilities over at the Votech now, and now we're moving them. But everything, we have to realize that really, until we come up with a plan of what we're gonna do on a permanent status, everything's on a temporary basis. And as Mr. Destin has asked, you know, the least amount of money we can put in any type of our offices, facilities, need to be very cautious with that, because of the fact that because of all the other mess we've been in, we've really not even addressed or dealt with the fact that, you know, we have people scattered all over the district, and we've came up, none of us has had we've not even mentioned it in months of what we plan to do with some kind of where we own house all these people and bring them all back together. And that's the reason that I hate to see us start moving anybody anywhere until we have a plan of where we ought all eventually be on a permanent basis. And even though this cost appears to be very minor, but we need to understand that, you know, we've had talk of moving this person to this place and this person to there, and you know, at some point, this board, we have, you know, we all understand, and it's nobody's fault, I guess, but you know, truthfully, we have absolutely not even discussed or have any kind of plan of what we plan to do with Miss Jackson and her personnel. And you know, we need to at some point get something to make a decision of what we gonna do. If we're gonna tear that old complex down, or we gonna move back in it. I mean, but and I hope you other board members will be thinking of what I'm saying here. And as we all know, none of us has even brought it up or mentioned it, and that's the reason I'm very hesitant to start moving anybody anywhere until we finally know where we eventually gonna be on a permanent basis.
Well, we met with all of you and discussed all of this with you at length, and there was no objection from anyone about making this move up here.
No, I'm not talking about like there. I'm just saying, Miss Jackson, it's not you. This board and none of.
We have a plan, Mr. Walker, but y'all don't want to hear it.
We've not mentioned. We've not made any decision about what we gonna do with the old complex down there.
And we need to.
I mean, there's been no decision made for what. I mean, because I know I've heard out on the street and everything else, and people say, well, why don't you move back in the old building? But supposedly now they're claiming that the new technology takes care of the mold and all that. But whether we tear it down, sell it, or whatever we gonna do, at some point we need to make some decisions about where we're going.
And this has been talked about for years, Mr. Walker, moving up here. We do have a plan. We've had drawings for years for exactly how to convert this building where everyone in the district would be housed in one place, close down all those auxiliary complexes, which cost a fortune to heat and cool. I've asked Bill Smith and Nick Koutsouradis to prepare that. We've been working on that. Now the problem is, you know, it takes money, and I'm trying to accomplish something with spending very, very little money. Staff is better off at this central location, which y'all know that, rather than having to drive all the way to the bay every day for employees. But this move is something that we've worked out here, and it's something that I feel is the right thing to do as the operations manager. But I do agree with you, Mr. Walker. I absolutely agree with you. We need to bring a plan forward to this board to show you what I see, you know, as long as I'm here, what I see the future is going to be. We have drawings right now today to renovate this complex and turn it into a central facility, which makes finance sense, business sense, travel sense.
Well, it makes some geographical sense.
It makes geographical sense. And I know Bill is getting ready with Nick to come to each of you and just show you what we see. But if we can make some incremental moves now that is best for staff and for the district and for parents who need, and employees who need to get there, I think we have a really good plan for kind of getting in here. We've talked with everybody here, and I think we're going to be able to do that. But money is the deal, and when the sales tax was rejected, and there's nothing I can do about that. But we can do some things right now. $13,000 is nothing to get the staff here. We would save that much in just travel in 3 months. Just travel.
Well, and I would just say also that Mr. Sansom and the staff at OTC has been extremely accommodating.
Yes, they have.
You know, we have employees sitting in hallways at desks, and we were there on a temporary basis, and we had an emergency situation where we had to get employees out of Lowry Place. They were immediately accommodated at OTC, but it's not something that we can continue to do, and I agree.
They're expanding there. And as I've shared with you quite often, we have buyers that want to buy that in Fort Walton right now. They would do it right now with the possibility of letting us lease a couple of those buildings for $1 a year until we could do what we need to do up here.
And would those potential funds be enough to accomplish what the plans for this place might be?
That's a very good question, and we would have to get a current evaluation. We've had some before. I believe Mr. Walker was very instrumental one time in wanting to get everybody moved here. Worked very hard, and then at the last minute, it just didn't. It didn't happen. Now, as far as the cost of here, we could get that pretty quickly. We would know what that
may be
is.
some of the kind of things that you're asking about, Mr. Destin. So-
But also the evaluation of what that property is worth at this point.
Right.
But like I said, you know, these people call me all the time. Are you going to sell it? Won't you sell it? We want to buy it. And I keep saying I just don't know at this point. But
Well,
it's
can I
some.
ask a question about
Of
that?
course, of course.
So, Mr. McInnes, how does that work if I mean, if we have multiple interest, how does it work? Are we able to sell it at the highest price? Or are we required to sell it at the appraisal?
No, we can put it out. Typically, you would put it out for a competitive response, and you would look for the high bidder. Unlike a purchase, when you're searching for a low bidder, in this case, we'd be searching for a high bidder. And so that's, if you were going to dispose it and sell it, probably we would do it through that process.
So we could do it competitively?
Yes, sir.
Excellent.
Oh, yeah, yeah.
I would just have one suggestion. This perhaps might be a subject for a workshop all by itself, because we're not going to be able to kick around all the details without having just a meeting dedicated to it. So I would suggest sometime in the very near future that
Sure.
we need to do that.
We can do that.
So we can look at the pros and cons.
Okay.
Okay. All right. Anything else, Mr. Destin?
That covers me.
How about it, Ms. Rush?
I would just like to remind the community that we have a tax holiday for school supplies coming up August 3rd through 5th. I wanted to thank our community partners with the Cram the Van program that provides much needed school supplies for our students at their respective schools. 3 Saturdays in a row at various Walmarts, and it's on the school district webpage. But this Saturday, the 21st, the following Saturday, the 28th, and also August 4th at Walmarts throughout the county. They will be collecting supplies that will go directly to schools in those areas. And I also wanted to remind parents, if you haven't registered, obviously, please go to your school and register your students. You could go online and submit your application for free and reduced lunch, or just set up your school lunch account. And also remind parents that immunizations are required. And also sports physicals. So all that information is available on the website. The athletics website has all the paperwork required to participate in athletics for the school year. And of course, our immunization requirements are also available online, as well as the school lunch application. And I know our school app, I haven't logged in this week, but that's another great resource for anyone with a smartphone, which seems to be everyone, that you can download the Okaloosa County School District app, and you can access almost all of those things that I mentioned: the school district webpage, the parent portal for student grades, school information. It's a terrific app, so I highly recommend that parents or guardians download that as well.
Anything else? Okay, very good. All right, anything else, Superintendent? Go ahead. Yes, ma'am.
The only thing I would say is we plan to go ahead with the move to get those employees out of OTC.
Right.
And if we have to do something else, if we can't get the 13,000, I will figure something else out. We have lots of good carpenters.
Ms. Jackson, I'm all in favor.
Oh, I
of
know
y'all
you
doing
are.
that.
I know you are.
And you know, we just did, and Mr. Destin made the best suggestion in the world. We all need to get together and make some decisions and move
I
forward
agree.
with something, because because of all the other mess we've been having to deal with, we just haven't been able to address it, and that's an excellent suggestion,
Yeah,
Mr. Dustin
and
made.
that's what we need to do. It appears we're trying to eat the elephant one
Right,
bite at a
right,
time rather than
right,
making a
right,
decision.
Exactly,
And we may well be throwing good money after
Right.
bad. We need to have a plan.
right.
And we will have a plan, but I will be, just so that we're clear, I mean, I don't want, we're gonna go ahead and move
Sure,
forward with
sure.
moving those employees.
No problem here.
Okay.
And as far as what you said, I mean, and I concur with the superintendent, I mean, we've been planning this since about 2000.
Many years.
The year
And
2000.
Miss Rush will be glad to give you some of her board money to make that move.
Hey, I hadn't thought about it.
And the only point I will make is I've not seen those plans to
No.
see that the numbers work and that we are actually saving
I
money
agree.
at all, so we need to do that.
I agree.
You can certainly see the plans, I believe, Bill, or Mr. Cox, somebody has
Right,
those,
right.
those plans. They've been in place, and we've revised them ever since way back when, wanting to make this move.
All right, well, if there's nothing else, then we're going to go ahead and adjourn this meeting.
Okay, thank you. All right. I will.